my name is Tashina Buffalohead. I am a community health facilitator with FaxNet Fear ICT project. Thank you for tuning in to this community health session. We will be discussing COVID-19 and how you can utilize different tools to protect yourself from this virus. This community health session presentation is for informational purposes only and is not intended as promotional or medical advice. Always seek advice from your healthcare provider regarding any questions you may have about medical concerns, conditions, diagnosis, and treatment. What is COVID-19? It is a virus that is similar to a cold or a flu. Coronavirus can cause severe illnesses. It mostly impacts the respiratory system, such as the heart and cardiovascular system. COVID-19 is spread easily between people, and it can also spread through contacts with surfaces and objects. It is spread by people by coughing or sneezing. Anyone who has COVID-19 can spread it, including people who don't even have the symptoms. How does this virus work? The entry point can be through the mouth, the nose, and the eyes. It goes down and it goes through the lungs. People become very sick, and it causes the mucus to build up, which causes the inability to breathe. So what are some symptoms of COVID-19? Some common symptoms of COVID-19 would be minor headaches, fever, cough, tiredness, and some people may not have symptoms at all. Less common symptoms of COVID-19 would be difficulty breathing. And like we said, it does hit the respiratory system. Rare symptoms of COVID-19 would be organ failure, heart disease, kidney disease, blood clots. But these symptoms are much less common now that more people have been vaccinated. The higher risk for severe illnesses are people with chronic lung disease or weakened immune systems, such as cancer, organ transplants, heart conditions, diabetes. People who smoke, are overweight, who are pregnant, and anyone 65 years or older. And how do you protect yourself from COVID-19? Social distancing. So avoid large groups when COVID-19 rates are high in the community. So the standard practice for social distancing is 6 feet. Wash your hands. Wash your hands often with soap and water for at least 20 seconds. Or like I tell my children, sing the ABC song. That always helps. Wearing a mask. So wear a mask when you are feeling sick, when others close to you are sick, when gathering in a large group, when COVID-19 rates are high. So get vaccinated and boosted to protect against severe disease, hospitalization, and death from COVID-19. And now we will talk a little about COVID-19 testing. Where can you get a COVID-19 test? So here's a list of some of the local resources here in Wichita. So for more information, call or access some of these resources, websites for availability and cost. And make sure you check out the Sedgwick County website for more information and recent updates. When do I need to get tested for COVID-19? Get tested when you have symptoms of COVID-19, when you're exposed to someone who has been tested positive for COVID-19, when you are planning to attend a large gathering and you have symptoms of COVID-19 or have been exposed, when you are planning to be in a close contact with children, elderly, or people who have medical conditions, when COVID-19 rates are increased in your area. So these are still the current guidelines if you test positive. If your symptoms do not improve 5 days after getting a positive test result, you must isolate through day 10 because you are still highly contagious. If your symptoms do improve 5 days after getting a positive test result, when you must mask through day 10 to reduce the chances of giving COVID-19 to someone else, through you are less contagious. In this case, you still go out as long as you are masked up. Make sure to check the CDC website for the most current guidelines. What are challenges with isolating at home? So in the past, I've had answers like difficulty staying away from my partner, difficulty staying away from my children, keeping things clean in the house. So the best practices when isolating at home. Friends, family may be able to help. Sleep in separate rooms or areas. Keep cleaning supplies handy. Clean the bathroom before and after use. Wear a mask and gloves, and wash your hands frequently. Now we'll talk about the COVID-19 vaccine. Why did you get a vaccine? And I want you to think about this because we all went through COVID-19. So I've had answers like, I did it for my parents. I had a weakened immune system. I did it for my kids at home. Benefits of vaccines are lessening the severity of the disease. Fewer hospitalizations, fewer deaths, and protecting you and the ones you love. COVID-19 information. So don't rely on social media for health information. So stay updated on COVID-19 information by going to the Center for Disease Control and Prevention by visiting www.cdc.gov. What is one thing you could do in the next 30 days to protect yourself and your loved ones? Thank you for your time today. So visit facts.fearict.com or scan this QR code for more community health session videos.